I'm Russ Gould. I'm the prostate cancer director at Wellness Place, and also involved with US2 International, which is a support group for prostate cancer patients. I'm probably most importantly a 13-year survivor with advanced cancer and still treating it all the time.
My name is Rudy Lombard. I'm an 8-year survivor as of this year, April Fool's Day. And I'm a research associate at the Robert H. Lurie Cancer Center in the Department of Medical Social Sciences.
When I heard those words, you have cancer, I thought, oh boy, maybe I'm not so invincible. Maybe I can't do anything about this.
And I experienced it as a death sentence. I thought I was going to be dying and had to figure out how to get my ducks in order in preparation for a transition.
And at that time I knew very little about it. And of course, the next thing is the feelings that many of the people get, oh, I have cancer. I'm going to throw up, I'm going to lose my hair, and I'm going to die. And in most cases, that is not true for prostate cancer. So for a day or so, pretty scared and so forth. All of these treatments, it's what happens in the first day, a week, a month, and then what happens long term. And you need to think about it that way. And we often say, oh, I can put up with anything for a day or a week or a month. Putting up with incontinence the rest of my life is a very different discussion, and that's one of the things that we have to talk about. A whole bunch of side effects that we're going to be facing, no matter which treatment you take.
I was, as most I think African American men do, they look for the least invasive therapy.
In some cases, I'd look at it and say, oh boy, I don't want that one. And this one, well, okay, I can live with that one. Some more stress in trying to figure out which way to go. And of course, that is equally as important as selecting the medical treatment. All of these side effects, and most of them end up causing some form of stress.
I thought it was important to find out everything you could possibly know. That's number one. Number two, my disposition was to seek out other survivors.
If you know what these side effects are, and you've had the chance to evaluate them yourself, and how they're going to affect you, and then the emotional side then comes into that too, in many cases, that you're much more able to deal with the stress and the strain that all of these side effects can cause. Talking to other survivors is one of the most important things that you can do. So we really need to tell everybody that you want to do as much of that as you can. And there's lots of ways of doing it, but make sure you get to talk to other people, not just the doctors. And by far the most important thing is get to other patients that are knowledgeable and have been through it.
There's a problem in terms of male machismo. They don't want people to think that they have trouble with erectile dysfunction or bladder irritations and so forth and so on. So they don't know who to talk to. I mean, there are times, I think, when it's absolutely essential that you talk to people who've had this experience. But even doing that, sometimes men are not forthcoming about what's really happening to them in terms of their sexual virility, whether they're having problems with erectile dysfunction or bladder problems, incontinence, and so forth. So you gotta try to make people feel at ease. And I think the more you talk to other men, the easier it is for you to deal with your own problems.